Hi everyone, welcome back to my channel. I am Shahan and today in this video I will discuss about Melkersson-Rosenthal syndrome. Now why I am discussing this peculiar disease like Melkersson-Rosenthal syndrome? Because there is a PYQ, there is a past year question from the different examination where I can find this right side diagram of the fissured tongue. Can you see the fissured tongue? That is the fissured tongue, and this fissured tongue can be found in Melkersson-Rosenthal syndrome. Melkersson-Rosenthal syndrome is characterized by this fissured tongue. So what is this Melkersson-Rosenthal syndrome? Basically, it is a neurological condition. It is a nervous disorder. And it is also known as orofacial granulomatosis. Orofacial. Oro means it involves the mouth. It involves the mouth. Which part of the mouth? Lingua. That means the tongue. That is the tongue. So which part of the mouth involves tongue? What happens to the tongue? Fissured tongue. Fissured tongue. Remember, fissured tongue. And this fissured tongue has a medical terminology known as lingua plicata. Lingua plicata. Remember, it is known as lingua plicata. Plicata. Lingua means what? Lingua means the tongue. And plicata means what? Plicata means the fissuredness. The fissured. So it is known as lingua plicata, the fissured tongue. This is a feature of Melkersson-Rosenthal syndrome. And remember, it is known as orofacial granulomatosis. Orofacial. Facial. Why the term facial is there? Because the face is also involved. What happens to the face? It becomes paralyzed. It becomes paralyzed. So facial paralysis occurs. Facial paralysis occur. Remember, facial paralysis occur. You can see the picture. The face has drooped down. So the left side picture, face has drooped down. So it is actually facial paralysis. So two important pictures and the two images of this disease are given. The left side is the facial paralysis, facial palsy, and the right side is the fissured tongue, which is known as lingua plicata. These two happens in Melkersson-Rosenthal syndrome. These two happens in Melkersson-Rosenthal syndrome. And why this happens? Basically, it happens because of the nervous disorder, because of neurological problem, nerve problem. Remember, it is a neurological condition. It is a neurological condition. And what is the region of this condition? Idiopathic. We don't know. So idiopathic neurological condition. Idiopathic neurological condition. So always remember, non-tendon persistent swelling of one or both lip is also there. Non-tender. So you can find the tenderness is not there, but persistent swelling of one or both of the lip you can find. Persistent swelling of the lip you can find. You can see the left side pictures, the both lips, you can see the lips of the woman is swelled, and these lips are non-tender. It is not a tender swelling. So it is non-tender lip swelling. Remember, non-tender lip swelling. This is also there. So what are the features I have discussed about Melkersson-Rosenthal syndrome? Number one, facial paralysis. Number one, facial palsy. Facial palsy. Along with that, you get the non-tender lip swelling. Non-tender lip swelling. When the patient comes to you, you can see the facial paralysis and you can see the non-tender lip swelling. And if you ask the patient to open your mouth and protrude your tongue, then the patient's you can see the tongue. That is actually lingua plicata. That is actually lingua plicata, which is known as fissured tongue. Fissured tongue. So this fissured tongue is a feature of Melkersson-Rosenthal syndrome. So it is a PYQ. Always remember, Melkersson-Rosenthal syndrome has a specific tongue known as fissured tongue. Along with fissured tongue, facial paralysis is there. So what kind of condition it is? It is a neurological condition. It is also known as orofacial granulomatosis because granulomatosis occurs here. This is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. It will help you to learn a lot of medical diseases and it will help you to crack your FMGE examination and NEETPG examination if you are preparing for it. please subscribe this channel. It will give you a lot of medical knowledge. I love teaching, and that is why I have created this channel. I always teach different medical conditions, different diseases which are always asked in different examination. I only teach those diseases which are asked in examination. I do not teach the disease which are not asked. I only teach the diseases which are asked in the examination. So please subscribe this channel. It will motivate me and it will help me to make many more videos like this. It will inspire me. Thank you so much. Have a nice day. Bye bye.